Hello. Okay. Thank you, Pretty, to joining us. Wow. Thank you, the team. Okay, everyone. So I know it's 2 p.m. and we agreed to do our mask Q&A with Dr. Sacha Hu. So I'm Stephane Colleu, President and CEO of the Dr. Brand Skincare and the Dr. Brand Foundation, and I'm really thrilled to receive one more time Dr. Hu, who already you saw it in our previous Instagram Lives Q&A. This one is going to be focusing on a Q&A regarding mask, and I'm very thrilled to have Dr. Hu, which for everyone to remind who is she. She is a board-certified dermatologist and associate professor at the University of Miami Miller School of Medicine. She has earned numerous accolades both on her medical practice and research endeavors, and she is also part of the Skin Advisory Board. So I'm going to ask her to join us, and I know everyone has a lot of questions regarding mask, and I think it's going to be a very entertaining Q&A that I'm looking forward to having with her. I think she's here. We go.
How are you? Hi, how are you?
Oh, thank you. You're having a beautiful t-shirt.
Well, yes, actually, I want to thank you and the whole team at Dr. Brand on behalf of my colleagues working at UN for your contribution to bring more PPE or personal protective equipment for our healthcare workers like nurses and doctors at University of Miami. So we really appreciate that. That's such a meaningful, loving gesture from the whole Dr. Brand Foundation and Dr. Brand Skincare Company. So thank you.
No, but thank you. We're so glad to have been part of it. And I think with the team, we agreed that something needed to be done. And we shift a week before the purpose of the Sell of You campaign and finding a way maybe to help our community according to the situation we're facing. And just for the people who doesn't know, it was a Sell of You campaign hashtag when we tried to support the University of Miami to provide PPE equipment like face shields, masks. And the team has been able to collect in 15 days $21,000, and we just sent the check this week, and we are very happy that can help in our own level. But thank you, our community, and everyone who has been part of this. So, and moving further, how are you today?
I'm doing well, thank you. I did a Peloton session this morning, worked a little bit from home.
Oh, you have the Peloton?
Yes.
The Peloton?
Yes.
How is it? Do you like it?
You know, honestly, I love it now. I was really into SoulCycle, but then it was getting hard trying to park and try to go there and then reserve a bike. So I got in Peloton like maybe 8 months ago. Initially, it wasn't easy because you're not as motivated. But now with the COVID crisis, it's just such a game changer because there's no excuse. It's right there. There's also a lot of community sense of support from the Peloton group cycling. Like you can send people hashtags, you can like high five. And so it's just really good. Like not only getting your workout in, but also feeling connected.
Be connected. Wow. So I was, so it's a very interesting concept. And obviously I'm glad that you have Peloton. I'm always wondering if I should purchase or not. So now I'm going to think another time.
But, you should. Highly recommend it.
So for people who just joined us, Dr. Hu is one part of the Skin Advisory Board of the Dr. Brand Skincare. And obviously for us has been quite for a few years now. And we've been very thrilled and very happy to have you. But most importantly, which I think I love about you, not only being a doctor and having your own expertise on the dermatological fields, I think, and tell me if I'm wrong or not, but for me, you're truly a junkie addicted skincare products person. And I think it's very unique because a lot of physicians have, of course, their expertise, but also they're looking on what they do in their own medical practice, not really on a consumer-centric side sometimes, which is more retail. And I understand that because they look on the pharmaceutical side of it, where you can have a lot of skincare line as well on the from the pharmaceutical brand. But I think you're pretty aware of everything, and you love to niche and to dig in, and that's why I was amazed to see that the first time when we met, and I saw how valuable it was to work with you, not only because on the consumer-centric side and retail side, but also, of course, on the dermatological field. So today we're going to talk about mask. And why are we going to talk about mask? Because we realize during the confinements that a lot of our mask has been booming by internet. So definitely there's a big interest in mask, and maybe people have more quality time, like you said with the Peloton, or people want maybe to take the time to pamper themselves, but also to go deeper in order to get results that they're looking for. And we know if we find the right mask, also there's a lot of chance that you can see some gratification. So we have a lot of questions because people were already very eager to ask a lot of questions. So again, thanks for joining us. So the first one is it okay to do a face mask every day?
So that's a very interesting question. So I don't recommend doing a face mask every day unless you alternate between different type of masks. The reason why it's not a great idea to do the same mask every day is because we know masks work by providing a little bit more concentrated ingredients compared to your routine daily cream and lotion. So mask is like almost like a power dose of ingredients that you want to step up your daily routine. That's why masks are so popular and masks are so effective because of the potency. For the same reason, so for example, if you have acne prone skin and you are already controlling your oil production, clogging the pores with a good daily regimen, and if you're starting adding a anti-blemish mask every day, the ingredients in the mask may actually become too irritating for your skin. And then so the downfall is that your skin may end up getting what we call rebound, increased production of oil as it's trying to compensate for dehydration. Your skin cells are also revving up the production as well because the mask can be very exfoliative. So when you do it every day, your skin cell actually work a little bit extra harder. So you may actually get clogging that you did not intend to. And then lastly, if you do it every day with the same ingredients, you may develop sensitivity to those ingredients. So I would say if you are expert skincare junkie, you can definitely try to play with the assortment or mask collection. You can do a hydrating mask one day, exfoliating mask the other day, and a brightening mask third day, as long as you are not using the same ingredients every day. So yes, it's doable, but for most people, it's not ideal.
An idea. But mostly, just to wrap up, it's to find the balance between your mask and whatever it is, but look very specifically what the purpose of the mask, because we have one mask is composed with pre and post biotic, but it's going to moisturize like the hydrobiotic, and this one, it's not a real mask. It's a mask that you use it, but you can leave it on your face, and it's going to suck into your skin during the nighttime. Then obviously your skin looks more repair and fulfill when you wake up. So in this regards, you can apply every
right. So sleeping mask is definitely a different category. So most people think of mask are like either sheet mask or clay mask or peel off mask, but sleeping mask can definitely be applied at night.
At night, yeah. So make the balance, guys. This is what it is. And obviously when it's more specific, which could be one of the questions we have today for you, which mask recommendation you're looking for acne prone skin, what you will advise to use it in terms of ingredients and to look deeper, because that's obviously a concern that people have been looking for a lot lately.
No, absolutely. Like acne or blemish prone skin is a huge issue for both women and men, teenagers and adults. It's no longer just like a teenager problem. So for people with combination skin, oily skin, blemish prone skin, even those with just blackheads, whiteheads, clogged pores, which is really mild form of acne, I like to recommend masks with either salicylic acid, which is a beta hydroxy acid, with a glycolic acid, which is alpha hydroxy acid. And there are other AHA and BHA, such as kojic acid, citric acid, malic acid. These AHAs and BHAs are very good and beneficial to, number one, they help to declog the pores by promoting exfoliation. Number two, they clean out the pores really well. And then thirdly, they help to brighten your complexion, because a lot of times when you have acne, you may also experience blemishes, induced stains on your skin. Of course, there is another ingredient that I personally love when it comes to mask and acne, which is clay. So clay is rich in mineral. Actually, one of the Dr. Brand skincare product has nice clay added in. So the mineral actually really literally binds to the dirt and oil deep in the pore and then clean it out, in addition to the exfoliative benefits of AHA and BHA. And then lastly, some of the antioxidants you find in botanical extracts can also be very beneficial for people with acne-prone skin.
Okay. So I hope everyone took notes, because there was a lot of ingredients, but very interesting to understand which ingredients to be more savvy, to make your own selection when you look to improve your acne-prone skin. Just us as a Dr. Brand today, we have what we call the vacuum cleaner, with that focusing more on the blackhead extract, which is composed with salicylic acid, which is one of the ingredients that Dr. would discuss about it. That's why we also combine with a lot of botanical ingredients like Ijitsu rose, which is a Japanese plant, which compensates potential irritation. That's why this product is still for all skin type, and usually we suggest each 3 days to use it, because especially depending on your lifestyle, if you're living in
it's powerful. It's definitely a very powerful mask, for sure.
And you can extract black. So another question is, can there be harmful side effects for applying a mask for more than what is directed to? And what would be the harmful side that we could be exposed?
Okay, so that's a great question. Again, all it comes down to the ingredients. So for example, masks with AHA or BHA or even retinol, if you leave the mask on too long, you can almost get the effect similar to a mild chemical peel, just because the longer you leave a mask on the skin, the more contact time the ingredients have on your skin, and the deeper the penetration. This is why a lot of times masks are, even they're potent, but they're not meant for you to be used for prolonged, for longer than 10 to 20 minutes. But on the other hand, hydrating masks, there is really minimal risk. For example, magnetite, I love magnetite myself. You can leave it on for a good 30, 40 minutes and nothing happens. It's very nourishing. It doesn't have the harsh or potentially harsh exfoliative effects. So it depends on the ingredients, it depends on your skin sensitivity, and depends on what other things you're putting on your face.
Yeah, okay. No, okay, good. And thank you for mentioning magnetite. For people who doesn't know, it's a mask, but you don't need to take off with water. Just a magnet will take away the mask that you apply on your face. It's very unique for people who didn't experience that, but it's going to nourish and having anti-aging benefits as well. So what would be a good mask for a treatment against rosacea?
So rosacea is, for a lot of people who don't know about rosacea is a condition that people tend to get red very easily. They have flushed cheeks, they have flushed nose. They may also get bumps on their face, like similar to acne, but they don't really have the typical acne distribution. So rosacea is really a sensitivity of the skin. So for people with rosacea-prone skin, I love hydrating masks that really balance out the redness. So ingredients such as probiotics, niacinamide, glycerin, nourishing lipids are really, really good for people with that sensitivity.
Okay. So, and yes, but you will, in this regards, how many times you will apply it just to fight against the rosacea and sensitivity? You can use it every day based on the follow-up and the ingredients.
Well, for example, the hydrobiotic is such a gentle mask. It's like a sleeping mask. You can use it every day. unless when people have prescription medication for the rosacea, then they may want to decrease the frequency of like a sleeping mask for rosacea. But then they can also do like a weekend mask. So if you only have mild rosacea, you can definitely use a mask every other day or even every day that's hydrating and that's gentle to really help your skin to repair that barrier and to calm down the inflammation or the redness. But if you're already on prescription medication, so you have to make sure whatever you're putting on in the mask will not interfere the absorption of the prescription medication that you're putting on.
Okay. Okay. So, by the way, for the people who are listening to us, you can raise any question you want to, and taking advantage to have Dr. Hu with us for the next 20 minutes. So, what would be a good mask against melasma?
So melasma is another condition that we see a lot of people are frustrated by. Melasma is a pigmentation condition where the skin is super sensitive to sunlight, which means that just a tiny bit sun exposure or will actually lead to significant darkening of the skin. Typically, patches on the forehead, cheeks, some people may get a little bit around the upper lip. So melasma requires a gentle mask with brightening ingredients. So brightening ingredients such as kojic acid, there's a whole tranexamic acid, there's also azelaic acid. All these brightening agents are very effective at targeting various stages of melanin synthesis without leaving too much irritation.
Okay. And I'm just jumping on one comment that people sent, and probably was related to the question we had just before. Is it okay to use mask also against eczema? Because eczema become a kind of dermatologist issue with skin disorders. So I think we need to be very concerned about it. And I think you're the perfect person to answer this question.
Right. So that is a difficult question to give a straight answer, because eczema in the mild form is just really dry skin. If that's the case, a nourishing mask is really rich in lipids, mineral oil, and glycerin. Like, again, the magnetite is perfect for that. However, if there's any sort of allergic component to your eczema, then it is important to first figure out what's triggering the allergy. Is it a specific ingredient, or is it something that you're using every day? Once you eliminate that, treat the inflammation, treat the inflammatory pathway, then you can address the skin hydration with a topical mask. But in general, if the skin is really red and irritated, you may not want to use a mask right away. You may want to heal that skin first, just because you don't want to trigger any flare-ups of contact dermatitis when your skin is not intact.
Yeah, and like we always say, if it's eczema, it's really the beginning of very important skin disorders. You should consult a dermatology first before using any products that you can find in the market, just by precautions, because you can amplify the eczema issue.
Exactly.
I think, Katie, you asked if we can use the hydrobiotic sleeping mask day and night. Like I think Dr. Wu said, it's such a gentle mask that obviously, yes, because not a traditional mask in a sense that you don't need to take away with some water. You can leave it and your skin is going to suck it. So in this regard, yes, you can apply EM and PM, but you will use the most benefits when your skin is not exposed from the outside. So that's why it's suggested at night. However, we have many other products during the day that could be also relevant for you. But if you have very sensitive skin and you're concerned and you love mixing microbiome, which is pre and postbiotic, with dermatology and botanical ingredients, maybe wait, we have a new products coming up, the Cool Biotic by August. And then it will be in July in our website. And these products could be used EM and PM, but for sensitivity skin or inflammation skin. So stay tuned. You will have an additional SKU that is going to join this range during the summertime.
Great.
So, Doctor, what do you think? What are your and opinions on multi-masking? Because also there was this crazy multitask SKU that everyone wanted to have. The products can do everything, so I don't need to follow my skincare regimen on every day because one product could fulfill all my needs, which I don't know what is your opinion, but for what I learned over my experiences, you cannot have only one product who can do everything. And I think the list of the ingredients beyond is telling the consumer when he should see the highest ranking to the lowest one, and he can see the main purpose, because the first 10 ingredients telling you mostly what the product is going to be focused on, mainly based on the ingredients, the formulation, and delivery system. So what is your opinion on that? Because that's something also we start hearing, not only in the products like we used to, but also for mask, having a multi-masking benefits.
So I agree with you. I think a lot of times when the tagline is "this can do everything," it definitely, you have to be a little bit suspicious. The scientific reason behind why it's very difficult to combine all active ingredients into one product is because there are a lot of issues for us to consider, such as stability. How a product, each active ingredient can stay stable and active when you're mixing ingredient A with ingredients B, C, D, E to Z. So the more ingredients you have in the pot, the more difficult it is to achieve stability. And then secondly, how much of an ingredient can you put in the product to achieve effective potency in terms of concentration? So think about, you cannot, it's literally like cooking. Like if you throw all the spices in one stew, it's not going to taste good, because you really want to be able to create a product that has enough potency, enough concentration, that is stable, and that is going to allow activity to remain relatively constant once it's applied to the skin. So for those reasons, it is very difficult to claim a product has active ingredients that are stable, that are active, and are not interfering with each other, and then still giving the same benefits once applied on the skin. But that being said, yes, our lives are super busy. People are looking for shortcuts into their skincare regimen. But there has to be a balance, because, for example, vitamin C can really help you brighten your skin, but it has to be combined with sunscreen. This is why we recommend using vitamin C in the morning under sunscreen. But retinol gets deactivated by sunlight. This is why retinol can only be applied at night. So those are tricky knowledge, like less known knowledge about the active ingredients most people don't realize. So this is why it's important to really educate yourself on what you're putting on your skin, why you're putting on the skin, and to create a balanced regimen.
The balance and regimen. Okay, but yeah, so I agree with you. I think discipline and consistency and understanding your skin type and finding, of course, the right products, that's the mainstream for everyone. But at the end of the day, you need to stick on a regimen and try to implement at least a minimum or 2-3 steps to at least like get the minimum. And I think the minimum for it's clean your skin, it's to, of course, repair at night, probably moisturize during the day, and making sure you protect your skin against sun damage, because that's the worst thing for accelerating the aging process. Okay, so there's someone is asking, it's totally different question, but she's suffering about high bag under his eyes or her eyes. I don't know if it's
yes, on her eye bags, right?
And then she seems it's genetic, which I understand. People, you can see much more puffiness, genetically speaking. What would you suggest to this person to do? And I think this person may be open to suggest to do right now from a topical cream, but maybe also from a dermatologist standpoint, because I know you have a lot of solutions today for any skin concern, and that's the beauty of it nowadays. I think if you look and see the right dermatologist, we can fix mostly any skin issue, which I'm always amazed every day, because that's true. If you can afford and find the right person, you can truly fix it, which is amazing progress.
Thank you. No, you're right. Like if it's hereditary under eye bags, that's usually caused by a combination of very deep orbital bone, which is really the bone that lined the underside of your eyes, and also a little bit of fat herniation. So the fat pads under the eyes tend to herniate over. So that genetic tendency is very difficult to treat with just using a topical cream. A lot of times I recommend people to minimize other conditions that will worsen under eye bags, such as irregular sleep, lack of sleep that would definitely give you puffier under eye bags, dehydration, so make sure you're hydrating every day. And then thirdly, if you have any recurrent or chronic sinus issues, which also lead to periorbital edema or swelling around the eyes, you should treat that. So if you do all the above everything that I just mentioned, you're still having a lot of issues, and then it's important for you to really look up who's board certified dermatologist or board certified plastic surgeon and discuss office-based procedures. But eye creams are very important, even though you're just having puffiness, because eye cream helps to hydrate the very delicate skin and protect your very sensitive skin around your eyes.
Okay, and for the person who raised this question, on top of everything what Dr. Hu just mentioned, just to tell you, this is what we're trying to do in our own level as a skincare line, but that's an extension of what we can do, what you can see in the office procedures. And today we have a product called No More Baggage. We try to give a fill matrix. So for people who have puffiness, you apply, you tap on a very clean face, and honestly, you're going to have maybe a minimization of the puffiness that you might suffer. Obviously, each individual is going to react differently. So some of them could be an amazing transformation. Some of them will be less. But if you're open, I would suggest you can look at it on No More Baggage. You can ask our customer service. And depending on your skin routine and skin type and your age, but so you can follow up also with a DNA eye cream, which has a lot of caffeine and peptide that will also continue to minimize not only wrinkles, but also dark circles that you might suffer or not. Based on that, but that's our suggestion for the person who raised the question.
No, I absolutely want to add no more baggage. You can also reapply throughout the day if you want to keep have that benefit throughout the day, and that's perfect for layering.
Are you using it? You seem very familiar about it.
No, I use it on the days when I'm not sleeping well. But so one of the positive side effect of COVID is that I'm actually getting a little bit more sleep than usual.
So I know Danielle raised the question if we are looking as a skincare line to provide to support a physician who are wearing masks for so many hours. So just to let you know, Danielle, we did that on top of just saying as an introduction that Dr. was very kind to thank us because we just raised up funds, $21,000 for the PPE to provide to the University of Miami, but also we have been providing different hospitals some products that we could do it. So Danielle, if you're interested in you, a physician or a nurse, just check with our social media, ask the question, and they will follow up with you if we can do anything for you and your team whenever you're based. It seems you're located in New York, but we already if I remember correctly, we supported a New York hospital, NIU, and whenever you are, send us a note on the social media and we will reply to you. So Dr. Wu, another question someone asked is, which kind of mask should we avoid? There is things that you think is very dangerous or scary from a doctor side, and what would be your advice to avoid as a consumer not to use it as a mask?
Well, that's a great question, because a lot of times we talk about what you should do, but we don't mention what you shouldn't do. So I would really try to avoid masks that have claim, 30% glycolic acid or a medical grade chemical peel at home, because those claims are often associated with ingredients that have not been responsibly formulated. And I have seen patients in my office coming to me after getting a severe chemical burn from using masks with those similar claims. So when the mask labeling has a very aggressive claim, that is telling you that you're getting medical grade laser-like effects with just one application, you have to be aware. And then of course, beyond looking at the labels, you really have to look at the fine prints where the ingredients are listed. So really make sure you are not using ingredients that you know you're allergic to. And for example, if you're pregnant and nursing, that's another special situation for you to consider. Certain masks are not safe for expecting mothers or nursing mothers, especially masks with retinol. So those are the top things that come to my mind when we talk about people, when talk to people about masks that you should not choose.
Okay, well, that's pretty clear. And I think it's a regular question, and I'm sure you had such a question with your patients as well, but also we do have that in stores who see our specialists. For those with oily skin, will an hydration mask products more oil, or will it normalize my skin? So for people with oily skin, they never know if they should find something that is going to moisturize, should find an hydration mask and not with a lot of oil inside, or it's contraindicated based on their current situation of a skin type, which is very oily?
So that's another great question. The common misconception is that when you have oily skin, you should not use moisturizer. But the fact is, oily skin actually also needs hydration, because a lot of things we do in our skincare routine to remove excess oil actually strips away the top layer of the cells. And now, as we mentioned very beginning of our session, how your skin is smart enough to rebound. So by adding hydration, adding moisture to your skin, even though it's oily at baseline, you are actually resetting that balance so that eventually your skin feels protected, that is not going to rev up the oil production. So in the long run, hydration, even for oily skin, is important and beneficial. But you do need to look at the label. So if you have a very blemish-prone skin, make sure there is, try to look for products that are non-comedogenic. Most oils actually don't clog your pores, believe it or not. Only certain chemicals can clog your pores. So don't be afraid of essential oils, natural oils. They're actually very nourishing for your skin.
Okay, no, but thank you. Thank you for answering this one. And I think it's someone just asked, should we patch test before incorporating a new mask to our regimen? I think this person probably is trying to find out if I'm oily, a combination, or dry skin, probably, but she's asking if she should do a patch test. I think patch test, you need to know what is it first, where you can find it, because not everyone knows to do that, and to identify probably the skin type. I think that's what probably this person is referring to. Do you have any answer for that?
So she may be referring to spot test. Yes, I actually recommend that once in a while. Okay. So there is either the medical office-based patch testing where you actually get tested for allergies, or you can do a spot test. Yes, for people with known sensitivity, for example, your face gets red very easily. Your face feels tight and burning after using a new product. So you may have extremely sensitive skin. What I recommend is that instead of using the product to your whole face right away, you do a patch testing to either behind the ear, so the skin behind the ear, or the skin of your inner wrist. So these two body areas have skins that are very similar to your facial skin, being that thin, they're not as sun damaged, and have a good amount of oil glands to react with. So do the patch testing once a day for 2 to 3 days, or even 4 days in a row. And if you don't have any reaction, then you should definitely be able to proceed applying the mask to your whole face.
Okay, but thank you for this one. And do you think a peel-off mask are very bad for the skin or not? That's also, what is your opinion as a doctor for all this peel-off mask that has been sometimes a little bit too crazy? But yes. what is your thought on that? Because on the market we see a lot of peel-off masks, especially the masks. What is your opinion on this one?
So I personally love peel-off masks, but I do understand the concern of over-exfoliation. Because, for example, if you're already using a topical retinol, if you're already washing your face with a salicylic acid cleanser, and you're using already a targeted pore cleansing clay mask, So if you do a peel off mask on top of that, your skin may be very irritated, and then you may end up getting rebound irritation, erythema, and whatnot. But peel off mask, when you're balancing with moisture, when you're balancing with other gentle ingredients, can be very satisfying, because what happens is that the peeling is a physical exfoliation. When you pull off that congealed polymer, and then sometimes it's very satisfying to see the clogged keratin coming off.
Is it scientifically effective? Because that's also another question. The peel off you just mentioning with the exfoliation is scientifically effective as well?
Scientifically speaking, is actually, people have done study. It's called tape stripping. So they can induce certain skin reaction by repetitively using sticky tape, which is like, light glue to the skin. And tape stripping is a way to induce various immunological responses. So yes, not exactly studies done in peel-off mask, but by similarity in terms of that mechanical adhesive reaction and then the physical action, yes, it's definitely exfoliative as a physical exfoliator.
Yeah, and then I think at the end of the day, let's get back to what you said at the beginning of the Q&A. It's a question of balance, guys. What you like, what works for you. As Dr. Brian, the peel off, we don't, but because I think, like Dr. Wu said, if you do the exfoliation, you're cleaning EM and PM your skin, you're going already to exfoliate. So the max should be executed for different purpose. And our objective is always to find scientific data and mix with safe but dermatological products, with mixing with botanical but dermatological ingredients. So that's why the exfoliation, we're using pharmaceutical grade crystal that used to be done for the microdermabrasion machine. You have a very deeper exfoliation. So in this regards, you get sure that you're going to have a lot of epidermis and cells that is going to be completely taking off from your skin. In this case, whatever you apply on top will have much more chances to penetrate into your skin. But at the end of the day, it's a question of balance and what people feel good about it.
Exactly.
And as a brand scum philosophy. But I think we cover a lot today regarding mask. I want really to thank you to taking the time and to get out from your Peloton bike just for our Q&A. So thank you so much. And
no, it's absolutely, it's my pleasure.
And honestly, because I know how passionate you are, and I think it would probably take a little bit much more time, but I would love to have you to talk about topics that we heard in my course a little bit too much, but I think it's time to also to understand what truly is meaningful or not behind that is the safe and clean. What safe means, what clean means. But based on data and scientific data, because everyone has their own perception of what is safe and what is clean. And I don't know you guys, if it's an interesting topic, you can follow up with us in social media. But I know also that's something you're passionate about it.
Yes, I think that's definitely something that deserves a deep discussion on.
And I know how savvy you are, especially with also what you're doing with your own website to try to guide and prescribe personalized customer skincare regimen. And you can mention again, what is, BioLife.com?
Yes, BioLife, BIALIFE.
Voilà. And then I know safe and clean is a big part also on the way you try to dig in about the products and just to make sure everything is relevant and proven scientifically and prescribed by a dermatologist. So it would be very interesting to exchange our different opinion on where the market is, what we think as a skincare, what should be safe and clean based on our value and philosophy and what we know as being Dr. Skincare Line, and you as a dermatologist and how you see the market on the dermatological field, but also for the consumer. I think I really look forward if you open to
yes, definitely put it on the calendar for sure.
Yeah, okay. But Doctor, thank you so much. Thank you for your time. Stay safe and healthy, and cannot wait to see you pretty soon in our own office.
Bye-bye. Yes, for sure. Stay safe and healthy. See you soon, Stephane. Bye, everyone.